In today's episode, we're going over a case study of a rotator cuff repair and a CrossFit coach. So, rotator cuff repairs are one of the most common surgeries out there, right? But I don't think there are very many physical therapists who are actually sharing the nitty gritty of what they do from kind of step one all the way up to step 10, back to return to sport and everything along those lines. What I wanted to do today for you is to give you an inside glimpse into how I rehabilitate folks after rotator cuff repair. So it's going to be a CrossFitter as well as a CrossFit coach. So in today's episode, we're going to be going over an initial diagnosis of what this individual had before going on to get surgery. What was the mechanism of injury? How did they get hurt? What was the actual relevance to rehabilitation, right? Sometimes that mechanism of injury is going to be important for how we rehab. What was the person's prior injury history and how did that reflect into rehabilitation? Who do we decide on in terms of a surgeon? We'll talk a little about the surgery specifics. So, what type of rotator cuff tear was it? What was the repair? Was there any concomitant pathology, right? Was there any arthritis or anything else going on inside that thing? What did our early physical therapy care look like? What did it look like as we started to advance over the course of time? How did we discharge? How did we return back to CrossFit over the course of time? We'll go over all that stuff. Welcome to the Fitness Pain Free Show. This is where we help coaches and physical therapists like yourself get your patients out of pain and back to training. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and a meathead. I have my dream job as a physical therapist, coach, business owner, and educator. And I've been doing this for several decades now. I want to help you reach your goals when it comes to coaching and being a better clinician. Before we really get going, I want to tell you about a free download I have for you that's going to allow you to understand this pathology inside and out. It is a rotator cuff pathology cheat sheet. I will leave a link in the show notes so you can definitely go ahead and download that and get started. We go over evidence-based treatment of the rotator cuff with tendinopathy as well as rotator cuff tears. We go over the prevalence of these injuries. We go over anatomy, mechanisms of injury. We go over the clinical presentation of these. We go over evaluation and diagnosis as well as treatment strategies and also surgical considerations. Who should go on to get surgery after a rotator cuff tear and who shouldn't? So I will leave a link in the show notes. Definitely go download this now for free. So who are we actually talking about today in this case study? Well, it's Brian Curley, right? So I'm not sure if you guys have heard of him. He's a very high level CrossFit athlete. He's competed at the CrossFit Games several times. He's currently not competing, at least not as competitive as he once was. But he's a great wealth of knowledge in the CrossFit community and is currently a coach. Okay. He's a 62-year-old male. And in terms of prior injuries that he has had, at least on the right side, he's had a tenodesis and a labral repair. In terms of goals, what does Brian have after this repair? Well, one, he just wants to kind of stay fit and healthy. He wants to be a better coach and a better role model. He's not actually trying to go back to higher level competition just because he's been so beat up over the course of time, just wants to enjoy his fitness moving forward. He will probably end up doing some local competitions. He's a competitive person, right? So we're not completely moving away from competition, but we're definitely reducing the amount of competing that we're doing in the future. He wants to be a master of technique for the Olympic lifts, as well as some of the gymnastics movements within CrossFit. So he really is not looking to get back to CrossFit quickly. He wants to get back as slow as needed. He wants to have a nice, smart return. So you don't have to rush anything. There's no no deadlines. So what are some important psychosocial considerations with Brian? Well, one, he's extremely dedicated, right? One of the hardest working guys I've ever had the opportunity to work with. If I tell him he needs to work out 17 times per week, right, twice a day, he's going to do that, right? He has this massive discipline. I have to be careful, but because of that, he's kind of that classic overdoer. So from an athletic identity standpoint, he identifies as a strong, fit, capable person, right? And he's definitely going to do exactly what I tell him to, which is going to really help my work as a physical therapist because I can essentially tell him to do exactly what I want to do. I know it's going to get done. It isn't his first injury. He's been injured multitude of times, right? He's been competing in sports and pushing CrossFit hard for, I don't know, probably about 15 years. And he was very athletic before that. And he understands the process, right? And lastly, he's essentially retired in one sense because he used to work a lot. Now he's worked a lot less right now anyway. He works part-time as a CrossFit coach. So he has quite a bit of time to rehab. This is a very important part of his life. So he's going to make the time for it and he has the time for it. In terms of relevant injuries, he's had some pretty serious pain on the left side shoulder in the past. He has quite a bit of arthritis on that side. However, his left side is actually his stronger side. On the right side, he's had a prior surgery, so he's gonna have a current surgery now on the right side. But in the past, he's had a labral repair and tenodesis on that side as well. And despite having a prior surgery there, he's actually more mobile on the right side, probably because this was his mobile side prior to this, right? The other piece is this right side was historically weaker than the left side. So after the rotator cuff repair, we're gonna have our work cut out for us. We really have to work hard to build that strength back because it was already weaker going into it. And like I said previously, he's a seasoned rehabber. He's done this several times. I've had the opportunity to work with him in the past. I know he knows what he's doing, and that's definitely gonna help me out as a physical therapist. So, what was the mechanism of injury? How did he get hurt? What was that injury? Well, he had a traumatic rotator cuff tear. And what he was doing was dumbbell pressing. So, he had some heavy dumbbells, and on the bottom of one of the reps, he kind of lost the weight behind him a little bit. He tried to save it, and then he just felt a sharp pain, kind of a tearing sensation within the shoulder. So, he went to see the surgeon and they ordered some imaging, ordered an MRI. And what they found, like I said, was a rotator cuff tear, but it was a tear of the supraspinatus tendon. It was also a full thickness rotator cuff tear. It was a large tear, and there were a lot of loose bodies. Afterwards, the surgeon kind of remarked to me that there was a surprising amount of osteoarthritis. I think there were 15 loose bodies within the shoulder joint. So it's just a sign that shoulder has taken a lot of, I don't know, wear and tear over the course of time. Shoulder's been working for the majority of his life, right? So, along with that full thickness rotator cuff tear, they also found a bunch of arthritis in there. And what that means to me is that A, we have a large, full thickness rotator cuff tear. We have to really respect that. Probably have to slow down rehabilitation a little bit. But the other part is the shoulder is a little beat up going into it. So, quite a bit of arthritis. And I think you can make the argument that you probably want to progress a little bit slower just because of the other concomitant pathology within the shoulder joint. So next, Brian just has to make a decision. Is he going to get surgery or not, right? And basically, he made that decision with himself. A little bit of feedback from me, and also information from Dr. Sean Rocket, who is a phenomenal surgeon that I really trust. He works with a ton of CrossFit, and they just kind of decided together that they're going to end up doing the surgery. Now, why did they decide upon that? Because I'm sure you've heard folks will tear the rotator cuff, and sometimes they don't need surgery. Well, for one, it was a full thickness tear. Generally speaking, full thickness rotator cuff tears will continue to tear more over the course of time and faster than a partial thickness tear. And the other piece is that if you have a large enough tear, the outcomes from a surgical perspective generally end up getting worse, right? The other piece is that when Dr. Rocket went in for the surgery, there was quite a bit of retraction present, which is also a sign that it was probably better that he got it repaired sooner than later, just because large, full thickness tears with retraction probably end up A, being painful, B, end up worsening over the course of time to the point where if he delayed this, he might not have the option to perform surgery a little bit later. Okay. And the other piece is that it was a traumatic tear, right? He lost a dumbbell behind him. And think about it from this perspective. So if you have a chronic rotator cuff tear, let's say that it tore and has maybe it began to tore years ago and kind of slowly tore over the course of time. As that tendon disconnects from the bone, what happens is that the muscle will end up having atrophy and fatty infiltrate, right? The muscle tendon will get stiff and it's hard to pull that muscle tendon back onto the bone to get a good attachment, right? However, if you had an acute injury, so it just tore, just pulled off, the tendon is actually pretty healthy. So it has quite a bit of hypertrophy, no fatty infiltrate. When we repair it, it's probably more likely to heal back onto the bone as a result. So acute cares tend to do a little bit better. And despite Brian being 62, he's still young. That's a young age for folks to have rotator cuff pathology. He wants to get back to high level training. So I think for him, it's worthwhile that we repair the tendon, get the function back, get the strength back, so you can do higher level activities, right? As opposed to saying, let's not worry about it. I'm not going to get surgery, which may not lead to a very good long term outcome, right? So, guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain Free Mini Course. So, I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So, in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So, schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym, 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to, because you can't get the patients through the door that you want to work with. Okay. So I'll show you how to do that. And lastly, we'll talk a little bit about the fitness pain-free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free certification. Now, the Fitness Pain-Free certification is the course, the certification that I wish I had as a new grad, that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain-Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain-Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. Talk about Brian's training age. Well, he's been training for a long time. He's been doing CrossFit basically since CrossFit started, right? Very seasoned CrossFitter. But he also has a large history of weight training. He loves exercise. It's a huge passion of his, right? And he's very, very good at following training programs. So I know for me, I can basically say, hey, do this exercise, do this exercise, do this exercise. He's going to know how to do it. I'm not too concerned with his technique always. Obviously, I'll take a look at it. If there's anything concerning, we can change it. But generally speaking, I know I can give him a program. He's going to follow it. His technique is generally going to be pretty good. I don't have to worry about, watching every little thing he does, because I know he has a very big training age. He also has a background as a coach. Makes my job easier. So Brian goes in for surgery, and it was a success. Phenomenal, right? So I like to communicate a little bit with the doc. So I ended up emailing Dr. Rocket to ask a few questions. He sent over the post-op report. He also gives me some guidance on what he wants me to potentially avoid, or when it's okay to push certain things or when to hold back, right? And he bases this off of all the information I talked about before. So essentially, how large was a rotator cuff tear? Was there any fatty infiltrate? All of those type of things, right? So the guidance that I got from Dr. Rocket, as well as the contraindications, for one, he wanted to wear a sling for 4 weeks, right? If you want some evidence-based guidelines for rehabilitation after rotator cuff repair surgery, I did an entire show episode about this. I'll leave a link in the show notes. But largely, if you wear a sling for a long period of time, so 4 to 6 weeks, just going to make that shoulder really, really stiff, okay? So in a lot of ways, that's probably good, because we kind of want this area to scar down a little bit. We want that stiffness. It's a large, full thickness tear. There was retraction there. So we probably want this thing to stiffen down a little bit so it'll heal a little bit better. If we push it a little bit too soon, right, potentially take away the sling, have Brian do a whole lot more on his own, there's a chance we increase the risk of a re-tear. So that was the reasoning behind adding a sling for 4 weeks, right? Dr. Rocket also wanted to be very conservative with this one. So he was kind of requesting passive range of motion only for around 8 to 10 weeks, right? And basically around 8 weeks, we can start to transition to active assist range of motion, right? And we'll talk a little bit later that the line between passive range of motion and active assist range of motion is a little bit blurry, right? And we'll see why. I'll kind of break this down. So like I said, this is a larger tear with retraction, and the doc was a little bit fearful of the degree of the shoulder injury. So he just wanted to make sure that we didn't push it too much, right? But here's the thing. If you're waiting for around 10 weeks in order to actually push someone's rotator cuff, you're going to have a lot of atrophy. And I mean a lot. And I'll show a picture a little bit later of Brian after the surgery. But He's a very fit, strong person. You just kind of notice that the arm kind of dwindles into nothing, especially in comparison to the opposite side if they're actually, training that side, the contralateral limb. Um, so we just have to keep that in mind. We know that Brian is going to get quite a bit of weakness over those first 10 weeks or so. And we really have a large mountain to climb once we get to that, 10 to 12 week period, we can start to push. The other thing is that if you are delaying this long to start more active range of motion and more strengthening, that's going to delay everything. So just keep that in mind. So when you start resisted range of motion, when you start, let's say, bench press or overhead press or snatching, whatever it is, that's going to be delayed even further just because you had to wait so long to initiate these things. So week 2, what do we see? Well, for one, I always like to take note of what the skin looks like. Does the incision look good? Does it look like it's opened up, right? Is there any kind of redness or signs of infection, right? And I didn't see anything, so no signs of infection. I always like to try to educate the patient and say, hey, if this is getting more red, any red streaking, just make sure that you tell the doctor it's not a good thing. You may be developing an infection. So if you see that, contact your doctor right away. The other thing that I noticed and actually got worse over the course of time. So think about it. Basically, I took this picture at week 2 as soon as physical therapy started. And if you're watching this on YouTube or the video version of the podcast, you'll notice Brian has quite a bit of atrophy on that right side trap, the back side of the scapula. You can kind of see a divot right where the infraspinatus is. I know this is not the best picture in the world. And the lighting is not great. But take my word for it, there's quite a bit of atrophy in the delt, infraspinatus, teres minor, upper trap, supraspinatus. It just looks like there's a lot less mass there in comparison to the left side, right? So if at week 2, things are looking like this, and he has another 6 to 8 weeks of not moving his shoulder, he's going to get even more atrophy, even more weakness, right? Thing is, if we push this thing too early on, we can increase the risk of re-tear. So I just want to note this. I'm not trying to say that week 2 you should be pushing strengthening. You certainly should not, right? But because there's such a period of time where we're not able to push this because we're protecting the rotator cuff repair site, you're going to have a lot of atrophy as a result. And just be prepared for that. So what did range of motion look like at week 2? Well, flexion was at around 100 degrees, abduction around 100, external rotation with the elbow at 45 degrees of shoulder abduction was around 45 degrees. Internal rotation in the same position was around 45 degrees. And essentially the physician protocol, so Doc Rock was cool with gentle passive range of motion, right? And basically until around week 8. So Dr. Rocket really wanted gentle range of motion for the first 8 to 10 week-ish. He didn't want to push things too much. So it was pretty conservative in the start of physical therapy. So this show is not meant to be a replacement for a protocol from a surgeon, okay? I'm not trying to give you those guidelines again. I made a fitness pain-free show episode where I go over evidence-based treatment of rotator cuff repairs. Leave a link in the show notes if you want to check that out. If you want a good protocol, I recommend the protocols by Wilk and Andrews, Lenny Macrina, Mike Reinold, all great rotator cuff folks, as well as the protocols from Delaware University. I'll leave a link in the show notes if you guys want to check those out. So what was our decision-making and clinical reasoning for the early stages of rehab? So I already mentioned this, but I think the biggest goal at the beginning is to protect the healing cuff tendon. Because if we do too much too soon, and I would say generally the evidence we have about rotator cuff repairs does support this. If we do too much too soon, we may increase the re-tear rate of the rotator cuff. And the problem with rotator cuff repairs, especially with these large and massive tears, is that the re-tear rates are quite high. So above 50%, upwards of 90% in some studies. So we don't do everything in our power to let this thing heal in the beginning stages, right? Because largely when a rotator cuff re-tears, it generally happens in the first 3 months. Okay. So those first 3 months are actually going to be super important. We want to make sure we don't overdo it in that time period. Allow this tendon to heal down as much as possible. Okay. Now, in terms of the movements we have to be most cautious with, abduction or flexion is going to be the biggest one. And that's just because the supraspinatus is what was repaired. And obviously, the supraspinatus is very active when you do any sort of abduction or flexion. The other piece that we have to be cautious with end range stretching. Okay. So I just said this before, but we kind of want that shoulder to stiffen up a little bit. If at the very beginning of rehab, I'm pushing aggressively to try to stretch the shoulder, I'm not allowing that stiffening to occur. So I'm actually okay if the shoulder joint gets a little stiff in these early stages in PT, and I see that as a good thing, right? Next thing we're looking to do as much as possible, and in the early stages of rehab, we can't do much against this, we want to try to prevent atrophy as much as possible. All right. So when we're able to, as soon as we're able to, we want to start putting a little bit of stress through this area. If we're going to be choosing some sort of motion, we obviously want to choose exercise with low EMG. But I'll tell you what's probably okay, what's not okay in the future as we make decisions about the right exercises. And I'll show you exactly what we did. We're looking to maintain sport and physical qualities as much as possible, right? So Brian loves to exercise, and having a rotator cuff tear is a real bummer, right? Because A, it hurts, it's hard rehab, but B, it keeps you from being able to exercise. It's super important for Brian. So as much as we safely can, we're trying to maintain all of his lower body training as well as training for the opposite side limb, right? Now, Brian actually stayed out of the CrossFit gym for a long period of time, which I think was actually pretty good for him. And he just knew that if he was in the gym, he was probably going to get pushed into doing something he probably shouldn't do too early on. He kind of knew himself. So I think it was actually a pretty good decision. But we'll talk about how he made that transition eventually back to CrossFit because we did end up getting there, right? And then lastly, how do we ramp up to get back to CrossFit? And we'll kind of go in depth about how we did that when we incorporated certain movements and how we progressed back to Metcon and all the like. So, guys, I have another video that I want you to watch. It's an evidence-based guide to rotator cuff repair surgery. I'm going to leave a link in the show notes as well as a link above my head right here. So go ahead and click on that link if you want to continue the learning. And lastly, I just want to say thank you so much for your support. You truly allow me to do what I love for a living. If you're watching this on YouTube, give me a thumbs up. I'd love to hear your comments and subscribe to the channel. If you're listening to this via podcast, please leave me a positive rating and review. It allows me to continue making great episodes like this in the future. And if you really want to go that extra step and support me further, please consider subscribing to Fitness Pain Free Insiders. It's a comprehensive online library that's going to level you up as a coach or clinician. All you got to do is go to fitnesspainfree.com, click on the programs link, click on Fitness Pain Free Insiders online library. There's a trial membership. It's super cheap to sign up. And you'll get some more great learning. If you're interested in any of the references, I'm going to leave the link in the show notes so you can check those out. Thanks so much for watching, and I'll see you on the next one.